PTF necessarily being.
So that will become
Thank you very much.
That will become so.
Absolutely.
Okay, before we, two questions here. When distress calls, who answers them? Is there provision for distress calls? How frequent portal put or tested so that it's always functional? Can you address those now?
So we actually have technical the private in the portal at 24 dealing with the issues as they crop up. And we've also consumer support for people arriving in Nigeria. The information leaflets that they will be used through the system in terms of how the gentleman, for instance, if he had got with the right somebody from the portal or from NCP's team, been sorted the day the barrel went out, that he was refunded his day, whereas it was taking him ages going round and round in circles. So we have a system that doesn't start with difficulty. In fact, I feel very well with this portal because we didn't even pilot it at the King. Time to pilot it, we just get it to open the airports. And of course, the PTF is a committee. It's not just me being convinced that this is the right thing to do. It's also convinced other members on the committee, everybody being that we have done whatever we can to mitigate the response. I remember Lagos State government, when we were opening up, they sent us data. They sent us data on people who had come in with the previous system we had. There was a particular flight where 40% of the passengers, 40% were positive when we tested them. 40%, and they said, you cannot drag us back. We spent over 15 billion naira sorting out our COVID problems in Lagos. You cannot then be bringing, we can't be bringing in 100, 200 new cases every day into Lagos. The state government will not take it, the federal government will not take it, and therefore we have to make sure whatever we put in place provides that confidence that things are being done to mitigate the risk for the country. But we very much appreciate the difficulty people are going. It's a difficulty that would eventually, even now as I speak, is being solved to a large extent. It's really the minority of people that will have it. If it's a challenge of payment, it will be sorted, but there's no challenge at the moment in terms of the QR code. It's the barcode we need people to work with, and we will be making it mandatory. Start having complaints that people are being denied boarding. So that's why we want the diasporans to be aware of this as a routine, because it's something that will continue to be there for months to come until the pandemic is over. And we don't know when it's going to be over. Maybe a year, 2 years, who knows?
Thank you, everybody. Dr. Sani Aliyu, Director of Presidential Task Force on COVID-19. You, the Chairman, CEO of. We're very appreciative of having the opportunity to talk to the authorities in a very short notice. That's really NATCOM living up to the expectation of coordinating diaspora concerns to the authorities in Nigeria. Yes, with the issue, the diaspora is really happy with the discussion because personally, I've not had information, but going to what has been written and video clips on the internet, it calls for a great concern that the diaspora should engage, talk to the authorities and know what this is all about. So now I'll have to speak at a high level because, like I said earlier, I've not traveled, so I don't have a first-hand information. As at now, I had plans to come to Nigeria in December to bring back my son, born and bred here in US, in Nigeria for his youth service. I had plans to do that, but I've not mustered the courage to do that just based on what I'm reading on the internet. For me, is discouraging. And the reason why I'm bringing my son into it is that, okay, my son is a complete American, but he's more Nigerian than most people. And he loves Nigeria, but if he's gonna travel and come to the airport and, you know, have this experience over and over and over and things like that, you know, don't you think that they will be discouraged? So I just to talk, you know, when this kind of to think inwards, how is it going to affect the diaspora? Because in my opinion, Nigerian diaspora is very crucial to our economy, to our well-being, to our socio-economic well-being in Nigeria. I mean,
Mr. Sorry, I think that is the essence of having this. And if you listen to Dr. Aliyu, he had actually tackled that. Since you didn't have the first experience, but as chairman of NIDO Americas, I think you've spoken generally speaking. And he has also said, don't be afraid. Your son needs not be afraid. There are people who've had good experiences, some have had bad experiences, and that is why we're here. And I think he has explained all those issues. So I don't want also deviate from.
No, I have a last request. I have a last request, madam. My request is this from the diaspora. You know, going forward, when policies that you know the diasporas are involved, how appropriate will it be that the appropriate authority gets with the diaspora to NITCOM, so that diaspora will be part of formulating implementation of such policies instead of us reacting as we are doing now. We are just being reactionary because we don't like what is happening. How in the future can the diaspora be integrated in such policy making? Because again, Nigerian diaspora is very crucial to our socio-economic well-being in Nigeria.
Okay, your point is noted.
Yes.
And
if I may respond, can I respond quickly?
Yes, please.
So thank you for your comments. Well, first of all, negative news makes news. If 99% of those using the portal are satisfied and 1% have a terrible experience, it's that 1% that you're going to hear of, okay? As I keep on saying, the majority of people don't have a problem with this portal. Of course, there are challenging issues for the minority, which we are in the process of sorting out. And to a large extent, we have. So for instance, if you pay and you go to a lab and they don't have your records, which was what happened to the Canadian chap, now you will get a transaction detail and the labs have been told to deal with you, take your samples and then sort out their system later on. So we are working on this. Secondly, the issue of diasporans, I can tell you, I'm a diasporan. I've been in the UK for 22 years. I have families that travel to and fro. I'm just as diasporan as any of you. The majority of the people working in my secretariat have links with the external world. They are not civil servants. So some of the decisions we take are decisions that as much reflect our need in the diaspora. I'll be back in the UK by Christmas. I live in the UK. So I understand your issues very well. I don't think we would have had a different situation if the PDF had gone through to the diasporans and asked them, what do you think we should do? Because some of us have already been there and continue to be there anyway. We are aware of the challenges. We are working on this. And I think it's not everything, every video that you see that you should take as the gospel truth or say that this is what is happening across the board. Thousands have come in, 27,000 we've cleared in the last 4 weeks. 27,000 people that would not have come into Nigeria if we hadn't placed this system in to be active. I really don't think there's an easier alternative to this. We have tried to accommodate the quarantine to shorten.
Yes, but certainly there's very little we could have done differently at this point in time to allow us to open up quickly. But if the alternative is for people to continue to struggle to come in because our airports are closed, then that's the other alternative, which we don't want, because we all want to be able to travel freely. So please let's continue to let's continue to talk, let's continue to converse, but at the same time, let's realize that it's not the entire portal that is ineffective or non-functional. And we have received as many compliments as complaints. In fact, more compliments than complaints. Over to you, Abby.
Thank you very much. We'll call on Mr. Wale, but in the meantime, somebody says, when will the PayPal option be functional? And then they want more information from the missions. Now we will get the leaflet from you and share on our website and ensure we share to as many diaspora groups as possible. So that's a question for you, but you can take that after Mr. Wale. Then somebody here says, Victoria says she had a first-hand experience and that she had no problem whatsoever. Why some said, like just admit with you that maybe a percentage have problems. Now, Mr. Wale, I know you were very vocal about this. Over to Olawale.
Thank you so much, Dr. Sani Aliyu, for the presentation, and Honorable Abike in particular, from always being proactive, not reactional. I am a typical example of passing message across to you, and swiftly you've been taking care of them, and most especially taking care of our concern at this critical period, bringing this close to the people. My name is Olawale Oditoye. I'm the coordinator of Legacy Initiative International CIC UK here. I must say more grease to your elbow. The only thing I would like to add, Dr. Aliyu, if you could add to the customer service portal the question and answer, which would be kind of interactive between whoever that wants to use it, rather than making calls, please. Otherwise, you're doing a wonderful job. Thank you.
Mr. Wale, somebody just said you ask your question and stop praising it. But we enjoy the praises. Thank you. Okay.
If I may, can I comment? So the PayPal, there were issues with the PayPal. That was why it's still not up yet. And in addition to PayPal, we are also looking at other payment portals to make it easier for people to use international cards. And we have a meeting with the technical committee tomorrow evening. I think the advice regarding the interactive question and answer, maybe what we should have on the portal actually is it's a system that allows people to type in their comments, just like we are having here, and we have somebody getting back to them with answers to their queries, rather than having just telephone numbers, etc. We do have an email that goes to NCDC, and I know it's a major part of their job every day to answer the emails, but maybe if it's public facing, it will allow people to see the answers to the questions that they may have as well. And the questions and answers that I have gone through today, I'll make sure that it goes onto the travel portal so that people have access to it. We already have a section with information. Over to you, Abike.
Okay. Also, it's also being suggested that I should put a chat. Okay, that's what you're saying. Okay.
Yeah, that's what I mean. Yeah, chat box.
Which I think is very, very, very fine. Okay, Honorable Tara, can you? Let's go through the questions you have.
Yeah, thank you very much, Doctor, and thank you everyone for this very important interactive session. I think most of the questions are the ones that are key have been answered, but I think there is one that I find particularly important, maybe from the scientific point of view. What are the probabilities that passengers will be infected in flight, despite all the COVID-19 protocols established at both ends? Because it does appear that people have already been tested and they've been certified to be negative. And that is the assumption that everybody that boards the plane is assumed to be negative. Are there possibilities that people get to be infected on board the flight?
Yes. So as I said, with infection control, you cannot eliminate risk altogether. You can only mitigate it. And that's the reason why we keep on harping on the 72-hour validity. As close as possible you have your test, the more likely it is to reflect your infectiousness status when you board the flight. So for instance, if you look at the incubation period for COVID, it's between 2 days to 14 days. But most people, it's a bell-shaped curve. Most people will become symptomatic around day 7. So if you were to catch COVID, or if I was to catch COVID rather than you, I will become symptomatic in 7 days, about 7 days from now. So if I did the test if I did the test much earlier, the likelihood is it will be negative, but I will go into the plane infectious. And that's why it goes beyond just the airlines looking at the test result you have, but also looking at you, whether are you coughing, do you have a fever, do you have respiratory symptoms, etc., and making sure that they don't board people. The biggest risk to me is really those on long-haul flights. And it's been shown, there have been studies that have shown clear transmission to passengers, but especially long-haul flights where people take off their masks in order to eat, they converse with each other, you're sitting close to somebody who is infectious, coughing and spluttering, and almost certainly you could catch it. But overall, the risk is really low. Generally speaking, travelers, passengers are considered to be low risk when it comes to transmission, because most of them would have been, the moment you are screened and you're tested, and at the same time you don't have symptoms, etc., you're less likely to be infectious, because it's not the entire period of COVID that you have that you'll be infectious. It's usually 2 days before the onset of symptoms and up to 3 days after. And beyond that, your infectivity status really drops significantly. But overall, what I would say is people should be comfortable that the aviation industry is doing a lot to prevent transmission. And I think most of the things that they have put in place, because the testing before boarding, the push for testing before boarding is actually being done mostly by the airline. If it was us in Nigeria, we could have put in place infrastructure to test on arrival at the airport, rather than asking people to test before boarding. But the advantage of testing before boarding is at least you have cleared all those that could potentially have COVID that would have entered the cabin, and also stopped them from arriving in Nigeria. So in other words, you've already gotten rid of the majority of those with issues, and you're only dealing with the less likely ones. But overall, okay. I don't think I travel frequently, and to be honest, I'm not too worried, provided I use my mask, I gel my hands, and I observe all those non-pharmaceutical interventions that we always advise. You should be okay. You should be okay.
Okay. The concern largely is from the point of view of cost for travelers. Having this test on both sides. Of course, some are suggesting why not the federal government, especially it may not have crossed your minds, but especially with regards to Nigerians who are in the diaspora, that these private laboratories, it's not that they shouldn't conduct the test, but the cost should somewhat be hugely or highly subsidized based on, from the thinking of people, the resources that are available, so that they can actually subsidize this cost for our own diasporas, wherever they are taking this. Because what is important here is that their data is captured at the airport. They have the QR code, which means it is certified that they actually came into the country through a particular airport, and they've passed through certain screens. So which means their data is available. This reduces the possibility of fraud or whatever in that regard. But the issue is they do this test at huge cost, maybe from the UK or in any other country. And then by the time they land here, they are now made to do the same thing. Let me put a follow-up to that. Already, the chairman, NIDCOM, has already raised this issue, but I think it's very, very important that we re-echo it. The responses to distress calls. What happened previously, of course, especially with regards to the viral video, is this issue of responses to distress calls. And I must really say that the complaints in that regard is the major issue about the kind of how professional it is to respond to people who make the calls, and then how effective it is to respond to the issues that are raised itself. And then let me just totally up all together. Then we've talked about how frequent the portal is being put to use, but that's not the issue. The issue is that where the portal fails, what are the backup mechanisms that will ensure that the person who wants to be served gets alternatives without necessarily having to insist or waiting on the portal, because we all know that most of these portals technically have load-bearing capacities. So at the time one is trying to log in, probably there are issues about space or data or storage capacities that cannot accommodate additional people from getting into the portal. And then in case there are issues, because there are sometimes problems where the portal itself may have technical malfunction and it may not actually be understood until much later. I'm talking, I'm saying this because of my background in that field. So I believe there should be alternatives or backup mechanisms where the portal fails. Is there any such mechanism put in place? Because effectively the major problem we can now see is, of course, like you've rightfully pointed out, 99% could be successful. But where communication is not effectively put in place, one, to mitigate and to provide effective communication to people in case there are such malfunctions. And then two, when the communication is not adequate enough, then all these problems will come up. Thank you.
So thank you. Very specific comments. Abike, can I quickly answer them?
Okay.
So I will start with a more controversial one, the issue of whether government should subsidize. So the main reason why we can't, as I said earlier on, it's really the number of passengers we get into Nigeria. It's nothing compared to Ghana or other countries. As I said, we get between 5,000 to 7,000 passengers when we fully open the airports every day for testing, for that come into the country, and a slightly smaller number that go out. The tests that we do, at the moment we've done just over 500,000 tests. The tests are very expensive. We all know public PCR tests are very expensive. Even in Nigeria and the developing country setup, they are expensive. At any point in time, we probably have maybe 300, 400,000 test kits available. The majority of these test kits are donated by our donors. We have some that we have bought. We are in the process of buying about another 500,000 or so. But if we were to take up the travel testing, we would run out of test kits in no time, believe me, because we will be tripling the number of tests we are doing every day. It is not sustainable. And even in developed countries like the UK, for instance, yes, you do testing and it's free under the NHS, but it's not for travel purposes. The moment you say travel, they would ask you to go private. We've had colleagues that have paid £250 for a test in the UK before coming in from the private sector. We are trying to push the cost of PCR as much as we can down for the private laboratories. But one of the things that we have said to the private labs is they will not be allowed to double dip. They cannot serve the public sector and also serve the travel. They have to do it only within the travel sector side. And the more laboratories we have coming onto the portal, the easier it will be to push down the cost. And we will push down the cost. I'm very confident that eventually the cost will come down. But at the moment, it's remember, unless we open up properly, even the cost of the tickets themselves will continue to be expensive. At the moment, KLM is not flying, Lufthansa is not flying, Air France are not flying. They are not flying because of issues related around the COVID pandemic, etc. So even the cost of the tickets themselves will be quite expensive and will be over and above any cost that you will be charged for coming into Nigeria to have a COVID test at day 7, which at the moment is about $100. It's less than $100 on average. Lagos is the only one charging 50,000. The rest are all charging between 36,000 to 39,000, and it will continue to come down to less than $100 per thing. And even Lagos, I'm very confident that we'll be able at some point to bring it down. So yes, we would love to subsidize, but I'm afraid it's not sustainable. Even for the public health side, we're just about to test corpus, 85,000 of them. We are having to look for the test kits in order to do this massive exercise. We cannot divert these precious kits to travelers in a situation where we are getting up to 5,000 people coming in every day. It's impossible. And then if we do it for those that are coming into the country, we have to do it for free for those that are going out. So I'm afraid it's a non-starter for the country. It's not affordable, and it's certainly something that we could have done for a few weeks or a month or two, but we cannot do it for a longer period of time. In terms of the backup mechanism, I just wanted to say when we started off the issue of the QR code, so when people finish with the portal, they are supposed to get an email of the QR code back. And we realized that those with Yahoo accounts, Yahoo was spamming the return email. So all those with Yahoo accounts were having to get in the QR code. We then designed a system where you go in, as you finish everything, you click a button and the QR code pops up on your screen and straight away you print it. So that's one of the backup mechanisms we've had. Since then, we've also included a system that where you have a completely different email HTTP, where you go in afterwards and you type it in, safer portals, and it takes you to a different site where you can generate your barcode if you are having difficulty with the main travel portal. So we do have a backup, but as I said, we didn't even have time to trial this at the portal. We had to just open up, and we are improving things as we go along. In terms of response to distress calls, absolutely right. That's why we're setting up the customer service center. Dealing with customers, it's important that we try as much as possible for the labs to understand that the customers are their main. They need to provide a good service. And for labs that are not providing a good service, we will penalize them. There's a lab already in Lagos that has come off the portal. There's another lab that has been having most of the complaints that we get, maybe because they deal with most of the passengers that come into the country, and we're working very closely with them. And if we are unable to resolve the issues, we will ask them to come off the portal. There are implications for people who misbehave, and I will please ask if there are issues with either forgery or illegal acts, just let us know, and we will take action straight away. These labs, we can penalize them. If they are not on the portal, they cannot do travel business at all. So there are ways around this. And in terms of addressing the quality assurance side, all the labs that are on the portal undergo the NCDC quality assurance process. We are also going to standardize the laboratory results for those that are leaving the country so that it will be standard, and there will be something on the certificate that will be make it very clear that it hasn't been forged, because we see forgery not only in Nigeria but also in passengers that are coming from outside. But we do appreciate the challenges. It's not easy setting up a system, an IT system. IT systems are not perfect in the same way that humans are not perfect either. And I think the more we can work together to resolve some of these issues, the better, because we really need from the PTF side to move on and start addressing other parts of the response, not just the international travel side.
Thank you very much. Before we call on Mr. Tony Isima, Bobo Lukoya says we should do a 90 seconds video stating the processes. We can work with you on that. And people want to know, I think you've mentioned when all the airports will be open. For instance, Port Harcourt International Airport is traveling there. So I hand over to Mr. Isima. Your quick comments, please. We can't hear you.
Hello.
Okay,
can you hear me?
Yeah.
Okay, thank you, Madam Abike, and hello, Sani.
Hey, how are you, sir?
Good to see you.
Nice to see you.
I just have a short comment, and first off is to commend the work that the country and the PTF has done so far, and this stuff is a tough one in our environment. But there seems to be some lag on leadership in the health and medical community. The voices are not there, not coming out to support the activities of the task force, also the essence of fighting or holding on, containing the COVID. Generally, it looks like the country has relaxed in so many ways, even in adhering to the basic preventative recommendations. And given the plethora of disinformation that has overwhelmed the world, it's increasingly more dangerous, given what we're seeing and even responses of people that should know better. So even when I speak to even people in health, the tendency is to play down the impact of the COVID or the presence of COVID. It's already there. We have to live with it. That's what all of us are doing, learning to live with it. And there's every need, one, to use the opportunity to, again, because part of it's primarily a health and a public health issue and crisis. And it's an opportunity to leverage and build on what we have. We can't, what we have is what we have. But then we have to now at least recognize our shortfalls and work to build on them. The labs we have, you've mentioned the quality control aspect of it. How much is the organized scientific lab community working with you in that aspect? Because that's part of the ethical elements that make people to conform. So it would be nice to see, use the opportunity to want to, again, enhance health and science issues, involve more of our university system and the Academy of Science, and particularly the organized medicine. They have to help, they have to speak up. I don't know how much integrated you are with them. And there's an organized hospital system or hospital organization, association in Nigeria. And more people go to those hospitals and to the site clinics. There ought to be some level of visible integration with the activities. That's an element that. Then we also need to, with the task force in hand, but please, this is very, very important. We have to be able to task ourselves to get a vaccine production platform. We did that in the past, in the yellow fever days, that created the Yaba lab. So that platform needs to be resurrected. And I think a task force, I know the government through the central bank has already done something, but there has to be something specific. You know, let the government charge the scientific community to with the manufacturers to give us a platform, so we can't continue to just wait for donors to supply us. So at least we've met some of their needs in counter. You know, in the counter payments, we've been able to correct. You know, which you did through in your former effort. So we need such challenges, and the task force is really in a good position to do that, working with the scientific community, so that we don't lose this chance. We don't lose this chance of you know, reviving some of the stuff we have on ground. It's just to revive them. Thank you very much, and thanks for the effort and what you're doing. Thank you, madam. Thank you very much. I think we've basically touched on all the questions. Somebody is asking, what was it I listed here?
Yeah, so
when will can you have these private laboratories at the airport? And then when will
okay.
Is there a plan to have it at the airport? And then when will this move to every state of the federation? So that when you travel to Lagos, you can get your test done in other states.
Indeed. So even now, if you arrive Lagos or Abuja, you're still allowed to go to your place of residence, provided you have paid. It's the onus is on the private lab to make sure that your sample is collected, because all we need is sample collection. As I said, we're just about putting up 6 additional states now on the portal. And what we said to the private labs that are currently working with us, there are 11 in Lagos, about 7 in Abuja, we've just opened one in Kanu, is that we want them to open up sample collection centers across all the 36 states. And it's not difficult because all you need is a sample, somebody who can take a sample. And it could as well be just an individual, and they pay him maybe 500 naira per person, and that person will collect the sample, put it, pack it, and post it to wherever the lab is. So we're going to give them a time frame to do this. If they do not open up sample collection centers, we will penalize them by taking away. We've accommodated about 4,000 naira, I think, also of their charges to deal with the logistics of having to have passengers outside Abuja. And if they do not open the sample collection centers, we will drop the current charges they are having to that respect. There were a few issues that I wanted to quickly go through. So, okay, you asked a very good question. Why are we not testing at the airport? So as I explained, if you do a test very close to the point of departure, it will reflect your result when you arrive Nigeria. If I test somebody who has done a test very close to the point of departure within 72 hours, and I test him on arrival, if he's incubating COVID, the likelihood is we will only pick about 7%, less than 10% of those that are incubating. It's too early to test at the airport. So there's no benefit of doing testing at the airport if you have a pre-boarding test. It's onerous, it will be exploitative, it will be unnecessary, it doesn't give you additional yield. However, if you do not test pre-boarding, yes, you can do a test on arrival, but the airlines are the ones that are also pushing that they want their passengers to be infectious. So they prefer clean passengers boarding the flights. And I understand that too, because if, let's say, out of 10, 2 would have been infectious, they come over to Nigeria, those 2 would have been excluded right from the beginning. They wouldn't even be allowed to board because they have a positive result. So that's why. The second thing is, even if we were to do testing at the airport on arrival, you will still need to do it at day 7 onwards, because there will be people who would be incubating. So that means you will still need at least a two test method to be very certain. For countries that can enforce isolation, and that's what I keep on saying, the issue is enforcing self-isolation. If we can enforce self-isolation, then you don't need to do that second test, because you come in, you have a negative test, you stay away from everybody for 14 days, you're fine, end of story. We're not interested in testing. But unfortunately, we don't have that luxury, Abike. And we know from the results we have that about 3.4% of those that come in with negative results will seroconvert and become positive. And if you're looking at 5,000 to 7,000 passengers, that's a huge number. It's a huge number. It's up to 150 to 200 persons every day. And Lagos at the moment, they are recording 20 to 30 new cases every day. You bring in 200 positive them. Do you think they will sit down and accept it? No, they wouldn't. And then it becomes an issue of, should we close the airports? And I'm sure none of us would want the airports to close again. So that's why we're taking the decisions that we are. One of the things that Tony mentioned is our relationship with the academic community and also the diaspora. And a lot of people don't realize we have a large technical team that work behind us within the PTF. And to me, this is the first time that people in the diaspora have actually influenced major policy decisions in government. And that's why some of the decisions we continue to take are sound and very much reflect what is going on in the international community. Some of our policies are no different to what you will find in the UK. Even the UK, they were looking at doing a second testing and reducing their quarantine period. But because they had a lot of elderly people, SARG decided not to do that. But the very same team that are advising the UK government are the very same team that also advises from a technical aspect in the PTF in terms of decisions to do with the science. There was a question about when will Port Harcourt, Enugu open. So it's one of the reasons why we're trying to open up more and more sample collection centers. We're very keen that the airports start operating. They've lost a lot of money, and unless we can get them to become fully operational, there will be job losses. So we're working on that. As soon as we have enough sample collection centers across the country, and we are confident that we have enough capacity for the labs to test, we will open up Port Harcourt, Enugu, and Kanu. I'm sure it will be in the coming weeks, but very soon. In terms of, there was a question about deportees. Yes, we have exempted certain groups from payment. Diplomats, because we had to. Children below the age of 10 do not need testing. You shouldn't pay. And if you do mistakenly, please let us know and we will refund you your money. Deportees, girls that have been trafficked, etc. Anybody who did not pay for his ticket, another state paid for his or her ticket to bring them to Nigeria, they will not be subjected to payment for the test. We will test them under the public health laboratory system. And I've addressed the issue of having tests, and yes, all state capitals having testing. Thank you. Over to you, Abike.
I think we've actually addressed all the issues, and if there are any more questions, please send to us, admin@nidcom.gov.ng. We will answer your questions through the PTF, and then we'll also work with you in terms of maybe the video Babolukoya suggested, the 90 seconds video. They will use all our platforms, and people have said this has been very informative from comments here, and they want it uploaded on several social media platforms, which we will do, working with the PTF. Thank you very much. I think on that note, I will call on Habibat. Let's have a woman give a vote of thanks. And then somebody says, those traveling from Nigeria, must they do the test before they leave? Maybe you just answer that. Is it compulsory?
Yes, so no. So in fact, that's something that we are very keen to put out. It's the responsibility of the passenger to find out the country you're traveling to, do they need a test? If they don't need a test, don't waste your money. If you're going to the UK, you don't need a test. So find out from the embassy, find out from the airlines. If you do not need a test when you're exiting Nigeria, you don't have to. You don't have to, because they have other systems for making sure that they are safe.
Okay, so thank you. I'll call on Adiza to give a formal vote of thanks, but our NIDCOM staff here are saying that the video will be available on NIDCOM website on all our social media platforms. So that will be our contribution to information sharing. So thank you very much. Habiba, your final.
Hello, good afternoon. And I'm Habiba Teluame from NIDCOM. I want to say that I've really enjoyed this program. I want to say thank you to the hosts, Honorable Abike Dabri-Erewa, the Chairman CEO of NIDCOM, alias Mama Diaspora. And I want to say thank you to Dr. Sani Aliyu for all his explanations and responses to the questions. We've seen that all hands have been on deck, working hard to ensure that Nigeria is safe. We want to thank you, Mr. Obinna, and your technical crew for putting all this together. We want to say that a lot has been going on, except for the video clip that went viral. And just one single video clip wants to negate all efforts put together by PTF and government. But I'm happy that Dr. Sani had responded to all the questions, and I please want the diaspora to know that they are always welcome home, because that man said he will not come to Nigeria again. So please, he will understand the problem that's caused his own problem. And I'm happy with the customer care center that will attend to people, the chat system, the email, so that if they don't pick up their calls, at least they can respond to emails. So we want to say thank you very much for this program. And I want to say thank you, Mama Diaspora. You are always there to listen to all diaspora and even the Nigerian citizen. I want to say thank you very, very much. I appreciate you all.
Thank you.
Thank you for having me. Yeah.
For those questions coming on the chat, those who say you want to reach us, I've given you the email, admin@nidcom.gov.ng. Just send us your email and we will take all the feedback on board. Once again, thank you, Dr. Aliyu, and thank you everybody for participating. See you again.
Thank you.
And travel home. Thank you.
Thank you, Abike. Thank you for having me. It's a pleasure.
Thank you very much. Bye.
Bye.